Within weeks of the election, Andy Burnham was bringing in unions, affiliated and, like my own, non-affiliated, to brief them on Labour's plans, to listen to our responses, and to commit to work with us on the upcoming health bill. And I have to say that has not yet been our experience of the current government. Indeed, whether in opposition or in government, I have found Labour to be the party that is most open and most accessible. And particularly important to me is the fact that when the Labour Party talked about the workforce and talked about the clinical team in the health service, they weren't just talking about doctors, they weren't just talking about the BMA, they were talking about nurses, midwives, ancillary workers, everybody who, in my opinion, matters when you're delivering a high-quality health service. The tribalism of partisan politics can be hugely off-putting to those of us who have not picked a side and become affiliated. And I would urge both Labour and the affiliated unions not to make the coming years a macho battle with the coalition. I believe Labour will lose as much support as they gain if they do that. And I suspect that women, especially young women with young families, or women with young families, are in particular uninterested and indeed turned off politics if it becomes an issue of parties attacking each other. And this is perhaps where the many non-affiliated trade unions can come in. We're not partisan, but we do bubble over with policy ideas. In my own case, those policy ideas aren't just about the midwives we represent, but they're about the whole health service, particularly about those services that represent women and children, in maternity services and its broader linkages. We are very willing to talk to any party that's interested about our policy ideas. We work with anyone who wants to listen to us. And as I have said, at the moment, that does appear to be Labour more than the current government. So I would suggest that the party should use us, grab our ideas. They are the parties if you want them. And our ideas are very much about the workforce, but they're also about the service users, not just our members. It's our belief that if we get the health service right for the user, we actually also get it right for the worker. I would say to Labour that you need to stick to the course of developing policies that focus on the needs of the server user. And in our case, as I've said, that's the key demographic of young women and young families. Used well, midwives can make a very significant contribution to people's lives, not just around the time of childbirth, but to their future lives as parents, and therefore to society in general. I would say to Labour that they mustn't become negative and be partisan in opposition. Labour built a coalition of voters that won 3 elections by focusing on ideas and policies aimed at improving people's everyday lives, and I believe that should continue. We're not affiliated to anyone as the Royal College of Midwives, but our core values, equality, fairness, equal access, an unshakable commitment to care based on need and not on an ability to pay, cooperation is our belief, not competition, and all of these are more traditionally seen as those of the left rather than those of the right. I would suggest that Labour should hold on to those values, and you can then count us as a friend. The party should also be utterly unashamed to champion trade unions, regardless of the current press. Unions are part of civil society and fundamental to building a good, healthy society. Very few people that we represent want life to be atomised, with individuals left to fend for themselves without the means to bind together and speak collectively. And of course, what we know from all the evidence is that the best workplaces, where people want to work and are at their most productive, are those very workplaces where trade union and management relationships are positive. Please do continue to reach out to us as a non-affiliated union, because all that evidence applies equally to our members as to members of affiliated unions. I'm sure that unions of all kind will want to work together against cuts to frontline health services and to staff numbers, and threats to an NHS pension scheme, which, despite the half-truths of the tabloids, has been reformed and is, in our view, affordable. An alliance of unions for the NHS will be a powerful campaigning group, strengthened by the inclusion of non-affiliated unions. Just to move on a bit to current policy, the challenge we now face from the NHS white paper is, in our view, extremely grave. I would question whether this is a government that's given up on having any strategic planning at all. The white paper seems to me quite extraordinary and prioritises the local over everything else, potentially leading to unnecessary duplication and pointlessness, internal competition, commercialisation and privatisation. And all of that is particularly worrying when you look at the workforce. We believe that we could see the situation where one NHS provider trust will not even want to train midwives, but will be quite happy to poach them from their nearby neighbour. And it seems to me that you cannot build a positive healthcare workforce if you do it locally. We would very strongly argue against the current position in the white paper. We're very pleased in terms of pay negotiations that with the independent pay review body is going to remain. At least that's what we believe is the case currently. And we would want to see Labour to be championing national pay bargaining and national determination of workforce. So let me conclude by saying that Labour must not retreat from social partnership. Keep the church broad, keep the tent big. Don't be ashamed or intimidated about speaking up for trade unions. I think we do an extremely good and vital job, and we can do it with you in order to build a constructive society and a healthy workforce. Thank you.